Hey, I'm Dr. Gerry Crete, and this is the first Catholic Journeymen web meeting, and we are going to be talking about internal family systems and parts work. Especially, we're going to possibly talk about firefighters. This meeting will start in about 5 to 7 minutes. So maybe you may want to fast forward through the next 5 or 7 minutes if you're watching this later. But welcome. Hey, Rob.
Hey, can you hear me?
I can. Yeah, I just
Great.
noticed that I have to let you talk. I guess I set this up as a webinar, which I'm new to.
Okay.
So I just
Yeah, I
allowed.
was I was looking for the place to join the audio and it wasn't there.
Yeah, I maybe should have just done it as a regular thing, but I can let people talk, so it's no biggie. We're always learning. Oh, Garrett as well. Okay. Well, I'm learning something all the time. So if I wanted to do make this like a live stream Facebook or YouTube webinar, then
Yeah,
you don't really want everybody talking. But this is a
right.
very internal group, so the webinar format may have been unnecessary. But hey, Garrett. Hey, Mac.
Hey,
I don't see you, but I can hear you.
yeah.
I'm using a computer with no camera,
Okay.
so I'm just a ethereal voice in the background.
Okay, no problem. No problem. I think it'll be a small group, so I'm okay with a small group. If you have questions to sort of pipe in, certainly you can. I think you can put something in a chat. But I allowed everybody to talk. But if we had a large group, I guess that would be too much. All right. I'm just gonna give it another minute or so, and we'll get started. I knew that it was Matt who actually asked for this topic or brought it or suggested it, but it sounded like he was really unsure if he could make it. I will be recording this, so he or others can watch it. Or hey, and if you loved it so much and want to hear it again, or you can listen again. So let me just see something here. I'm gonna check on. It said there were 4 people that were. So Jacob and John are 2 people that said they were coming. So Matt actually never said he could for sure come. So I guess we'll let them have a minute or two, and then we'll just start. For what it's worth, I had a nice day today. I did cooking therapy and got up, and instead of doing all the work tasks that I probably should be doing, I made like 3 dishes and watched TV while I was making them, and somehow that made me feel good. And then I went for a 2-hour walk, and I caught up with my daughter who got back from her honeymoon, and she had a nice time. So,
Cool. Where did they honeymoon, Gerry?
they're in Cancun.
Ah,
Yeah, so they had no trouble getting to Mexico and back, and even the hotel arranged for the COVID tests to, it would have been tricky if they had tested positive for COVID and had to quarantine there. Yeah, that could be pricey, I would think, but luckily that didn't happen, so it's all good. They went to see a Mayan pyramid, which I've never seen.
we have one of those in our backyard.
Do you? You tell.
We got a Mayan pyramid, an Easter Island head. Oh, wait. That's a miniature golf course. My bad. My bad. I'm sorry.
That's great. Yeah. Oh, well, I'm going to just get started, and because this just goes till 5. And so what we're going to talk about, well, this is a little more educational format, a little more lecture format, but I am totally open if there are questions that come up, especially since we're a small group, and or comments or whatever. And I was thinking, if it feels right to you guys at some point, we could even do a little exercise with it to make it real. But that's just up to you guys if you want to do that. I'm just going to start off with more a little bit of explanation of what internal family systems is, or what parts work is, and kind of go from there. And so, especially if I say anything that doesn't make sense or maybe requires a little more explanation, or I use a term that isn't common, Just, feel free to either put it in the chat or just, I don't know if you have the option of raising your hand, but I don't mind if you guys just talk. All right. So what's interesting about this model is that it was actually, if you talk about internal family systems, it was a marriage and family therapist, Richard Schwartz, who developed it. And he actually discovered, and I want to say it would have been the 1980s. I could be wrong on that, but I think it's around that time. And he was working with especially patients who had a lot of serious, crazy trauma. And he had been doing some work where he was identifying within a person that there were maybe different parts at play. And you see some of that you could get from way back, Bradshaw, various people who were kind of like doing that inner child work, where you kind of identify, hey, we have an inner child inside of us kind of thing that is kind of still with us. And we need to learn how to speak to that child, or we need to learn how to relate to it and hear that child and this kind of thing. And healing, there's a lot of really cool healing work with that whole inner child movement. And that's just an example of a part. And so Schwartz was doing some work with kind of adapting parts. And he was, because he's a marriage and family therapist, he's been trained in what's called systems theory. And systems theory tells us that we're like families are like systems, communities are systems, everybody's brought in a system. And so if you're in a family, then you're affected by everybody else in your system. And if you make a negative change in that system, it affects everybody in some way. If you make a positive change to just one person, it affects everybody, right? And so, it's really this whole idea that there's a structure to a family, and when you change the structure, you can make improvements or have worse effects. So anyway, this is a whole way of looking at therapy that family therapists are trained in, whereas like your typical psychologist is trained to really look at the internal workings of the inside the person. So it's more of an internal psyche, right? You all the way back to Freud with the ego, id, super ego stuff, and you're trying to uncover the subconscious and bring things to light and blah blah blah. So that's the traditional path, whereas the systems way of doing things is finding amazing results by just changing the person's system, right? I always say it's like, I remember as a kid going to the Hershey's chocolate factory or watching Laverne and Shirley and the beer factory or whatever, and you do one thing wrong in the chocolate factory, it ruins the whole, the chocolates aren't going to come out right if even one part of the whole system is messed up in some way. And so you have Laverne and Shirley waiting to the end of the show. They have to wait for to get her, I think is it her glove back? Anyway. So the point is, what Schwartz discovered is, though, inside our person, our very self is actually a system. And that all of we have different sub-personalities, or call them parts, that exist that within us that have their own kind of interests and their own experiences in a sense. And that when we get to know those parts of ourselves, we can kind of work with them. And he worked with really severe trauma clients, like people that weren't really getting good results from normal therapy. And when he discovered their wounded parts, right, a lot of times that might be seen as kind of like that inner child, maybe. And when he started doing work with those parts and recognizing, as well as the inner child, which would be like the wounded part, there were other parts like managers and other parts that were within a person that were sometimes in conflict or were protecting that inner child. And if you ignore them, you're going to get negative effects. You're going to get some other effect. You're not going to have as much success. So he started working with really getting to know all of a person's parts, helping them learn about their parts. And once he was doing that, he was finding tremendous success, even with really troubled, really difficult clients. Now that's Schwartz. And then he, of course, over years of working this program, like working it and discovering it, and that he created an entire approach to therapy that was called internal family systems, and people are trained in that and are using that, and there's lots of books, and you can go on YouTube and watch videos, and so it's this whole thing now. It's really popular. I find it super effective. Interestingly enough, even before Schwartz, though, there were some pioneers in this area, and there's another type of parts work that I've become been learning more and more about, called ego state therapy. And so before Schwartz, they were already talking about parts. They were calling them ego states, and recognizing that these different ego states are all part of the self. All right. And so I might refer to both a little bit of ego state therapy stuff, which comes out of the hypnotherapy tradition, as well as internal family systems, which comes out of the families therapy background. Because that just gives you a sense. I wanted to just provide a little context of what this therapy kind of is and where it comes from. So I want to make this as practical as possible and zoom in on things that might be interesting to you guys, and whether you do this type of therapy yourself, or like you have somebody do this with you, or you just sort of like can use it in your everyday life a little bit. And so I want to point out, according to Schwartz, there were a number of different kinds of parts, and that we all have. And then according to Schwartz, there's a core self. I really like this concept, and I find it's the most intriguing part as a Catholic, because what he found in all of his work, and Schwartz is not Catholic. I don't think he's Christian. He may be a secular Jew, or maybe he's practicing Jewish, but I think he's not Christian. But what he discovered was that once you kind of get to know all the parts, then the self, you could call it the true self, the core self, whatever, the self emerges. And that the self has certain qualities that just are always there, right? So the self, I want to make sure I don't have any messages from anybody trying to get in or having trouble, because I just got a bunch of messages. Let me just quickly check on that. Oh, never mind. Okay. The self is always compassionate. The self is always kind. The self is always curious. The self is always calm. The self is always patient. The self is always wise. And so when I was learning about this therapy, I was going, that is so fascinating, because that kind of sounds like a person who has been filled with the Holy Spirit, or a person who is like, that sounds like the gifts of the Holy Spirit to me. That sounds like the person created in God's image. Like that sounds like that would be compatible with a Christian worldview in a way that I haven't ever heard in other kinds of therapies quite the same. So I really started getting interested in this idea of the self, and I'm still learning. I'm still figuring it out and kind of mapping it to like solid Orthodox kind of Catholic theology to try to make sure it fits and figure out what's correct and what might need to be tweaked or understood from a Christian perspective. I've kind of come to the belief that the soul, there's a part of the soul called that sometimes in Greek is called the nous, sometimes in the Bible referred to as the heart, sometimes the mind, but it's this sort of the Greek word in the New Testament is nous, and that is kind of the faculty by which we connect with God. As well as we have reason and we have a will. So if we get Thomistic about it, we also have a reason and a will that kind of make up the soul. And so, anyhow, that could be another talk, because I would really love to talk more about the self and what that is. But it's always Schwartz's remarkable experiences, no matter how bad the person behavior is or trauma was or whatever their messy life, when you separated out all the parts and the self emerged, it has these qualities, and that's just what he found. All right, then, so I want to get into some of these parts. Okay, so one type of part that is pretty common is our manager parts. So we have a manager that, I would think about it as I have a manager part that's really good at doing tasks, that is busy, that likes to achieve things. I have a really good manager doer part that's active a lot, and so that's cool. That's a manager, and I might come in conflict with some other managers. Like I might have a manager that's kind of in charge of recreation or whatever, like likes to relax, likes to enjoy a good time, likes to socialize, right? So we have different manager parts. The way I look at it, sometimes I think I've used this analogy before. I have a part that wants to go to the gym and work out and get fit. I have another part that wants to sit on my lazy boy chair and just binge watch TV. So I don't want to let either one of those parts take over. And in internal family systems, we would call that blending. So if a part blends with the self, it means that part is sort of dominant. It's kind of running things, right? It's blended in with the self. So we're less aware of our core self. And that part is what's interacting, what's speaking, what's interacting with our friends, our spouse, our kids, whatever, like is more that part. So if my manager part that's a doer, a task-oriented achiever, is totally blended in with the self, then I'm a little bit one-track minded. I'm like on top of tasks and only interested in tasks and busy with things, right? And so I don't want that to be the case. I want to use that part. I want to activate that part, but not let it run the show. If that makes some sense. And then we have parts that I mentioned before that are wounded. So those are sometimes called, in internal family systems, they're called exiles. And that's a part of ourself that has been wounded or hurt in some way. So I see that as some kind of trauma. It isn't always has to be war zones and rapes. It could be like being bullied at school. It could be some moment as a kid when you were yelled at, or especially if it's something chronically that happened, that for whatever reason, we were hurt. And rather than feel that pain or get help for that pain or work through that pain at the time, we basically said, our internal system said, holy crap, I can't handle that pain. Make that part of me now that's feeling all this pain go away. So we exile it. We block it up in a closet or in our brain, or it just somehow is repressed, compartmentalized, whatever. It's I don't want to feel that. And then another part emerges there to protect it. So we call that a protector part. So we're typically dealing with the fact that we have a protector part whose job is to make sure that we don't have that wound anymore. That wound doesn't feel any pain anymore, or we don't feel the pain. And so we have a protector part guarding, if you will, a wounded part called an exile. All right. So I could go into more detail on that, but maybe that's a good place for now to just sort of understand. Oftentimes the protector part might have some relationship to the wound in some way. Like, I don't know, I'm thinking if the wound was you fell on your face and embarrassed yourself and everybody laughed during the school play, I don't know. So there's a little part of you that learned in that moment, I'm never going to embarrass myself. I'm never going to embarrass myself again in front of people. That protector's job might be to make sure you're never in a situation where you'll be that embarrassed ever again. And that's the protector. The wound is the little kid who fell and everybody laughed at him. All right. So that is just sort of put away. And the protector's usually pretty strong. So if somebody comes to you and says, oh, you've got such a beautiful voice, I heard you at church, would you consider joining the whatever church musical or something? The protector's like, no, not going to do that. Not going to happen. Right. It's going to be, the protector will sort of leap out kind of like that in that moment. So that's that setup. Now, as life happens, our managers and sometimes like our protectors something gets through. So the way I would see that would be the protector, I don't want to say falls down on the job, but in some way is compromised. So maybe someone we love dies. Maybe we lose our job. Maybe pick something that happens that it's kind of overwhelming or really difficult, and somehow whatever the protector's defenses were just didn't work. So then the wound is exposed in some way, and that hurt and pain is suddenly present in a way it's been guarded for a long time, so it hasn't been present. All of a sudden you feel it. So the system doesn't know what to do with that. And so another part shows up, and that part's called a firefighter. At least that's what IFS calls it. And a lot of time that the job of that firefighter is to make sure the kid or the wound, or the exile, and that pain goes away. It's a whole job. And it's it's an emergency. And so, like a firefighter, he doesn't care about your house. If your house is on fire, he's breaking down the door, he's smashing the window, he's muddying your carpet, he's whatever. So he's just going to come in and take care of business. And so what are typical firefighters for most people are things like alcohol, drugs. It could be some other numbing activity, like could be video games or binge watching Netflix. It could be overeating. It could be any of those behaviors that that basically numb us out or take care of pain. So all those behaviors might be fine in many circumstances, right? Like having a drink might be a fine thing. It might be a social thing. Playing a video game might be just fun or whatever. It could be recreation, right? Even exercise, right? Could be a firefighter, but all those things aren't always firefighters, right? So there's sometimes they have a good use. But the difference to know whether it's a firefighter or not is if it's numbing pain. And some pain is like obvious, like somebody we love dies, and you just drink a lot or something because you just can't handle it. It's like super obvious. Okay, that's a firefighter just showed up. Other times it's less obvious because the pain is less obvious. Like, because we're especially men, I think, but maybe everybody, like we can tolerate a certain amount of pain. We're sort of stoic sometimes. We sort of repress it. We're not noticing that our protectors are kind of getting compromised. And all of a sudden, what happens is we're sort of chronically numbing more and more. That I find happens a lot more these days to people, where it's not a noticeable event, but it's more like a chronic response that after a while gets more and more pronounced until suddenly it's really causing a problem in life. In any event, the recognition here that there's a dynamic where the firefighter comes in to take care of business. When it becomes an addiction is when that firefighter is constantly being evoked because there's so much going on and the person can't handle on their own. So firefighters kind of really, that whole dynamic, when I first learned internal family systems and I learned about firefighters and how they come about, it kind of changed my whole view and my whole understanding of addiction, because I could see where it comes from. I think there might be, like, obviously in some addictions, there's a chemical or just pure habit component, but unless you get at the wounded part and you address the fire, yes, you have to address the firefighter. Yes, you have to get to the wounded part. Unless you get to that and do some healing and work with that, you're always going to be set up for the potential for the need of a firefighter. But the problem I found and what I learned as a therapist was that if I just leap in with inner child work, I'm actually ignoring the protector. And for a lot of people, consciously or unconsciously, they put up a wall, right? And that's why so many people like don't want to go to therapy, especially guys. Like, why would I want to go to therapy so that I could relive that pain? Why would I want to go to therapy, to trauma therapy, to to like talk about this horrible thing that happened to me. Of course they don't, right? And the protector is the one saying that, because the protector's job is to make sure that kid doesn't feel pain anymore. So you actually have, and for this approach, this therapeutic approach, you actually have to meet the protector. You kind of have to meet him, and you have to talk to him and get permission to spend time with the wounded exile. And he needs buy-in. And in eco-state therapy, the therapist sometimes does that negotiation directly with that protector. In IFS therapy, the therapist helps the person bring out the self, or discover or get in touch with the self, the core self we were talking about before, and have the self approach the protector. Either way, I actually like the IFS approach there better, but sometimes, depending what's going on, the other approach is more direct and necessary in the moment. But ideally, the self is the one, your core self is actually looking at your protector. And so if we use the example of like what I was saying, like the protector that won't let the person do anything that will embarrass them socially, you know, the first thing you have to do is actually empathize with that protector and even thank it. Like noticing that part, like notice that part of yourself and say, okay, for all my life, you've been like majorly protecting me from being embarrassed. So because that's what you really, that part of me really thought I needed to do to survive. So you kind of had to thank it, you know, rather than go, like, I'm so shy, or I'm such an introvert, or I have social anxiety, or whatever. I'm just, that's like just making it into a pathology, making it into, I'm so bad, right? And some protectors are really critical, right? Like they're super critical, and you think there's no good about them. But when you get to meet that part of yourself, you go, oh, you've been critical. Maybe you've sounded a lot like my mom or my dad or somebody who's so critical of me. But you've been doing that because you think you have to keep me safe. It changes the game, right? Rather than just going, oh, I have a part of me that's super mean, or, you know, just I have negative beliefs and all this business. No, yes, but in reality, that part has been trying to survive that way. That's what they learned, maybe really at a young age. So you connect with that part and you're like, you've been spending your whole life protecting me from being embarrassed, because you think that if I try something new, I am going to get like I did when I was a kid and fell on the stage and everybody laughed. You think I'm going to be socially annihilated or humiliated. I won't be able to recover, and the shame will be overwhelming. And the answer is usually, yeah, exactly. And then it needs to be like, okay, I get it now. So you have to connect with the part. And then there's an aspect here where you have to go, well, I'm not that little kid anymore. And right now it's causing lots of problems in my life. Like I can't do, I turn 5 shades of red, or I get sick for work if I have to do a presentation, or whatever the problems are, current problems. Say now it's really causing the fact one point you saved me, but right now it's actually hurting. Would you be willing to let me work with that wounded part so that the wounded part can get what it never got before? Right? Because I think that wounded kid, that exile, believes he's bad, or he's, you know, he was laughed at, so he's just carrying lots of shame, or he thinks he's no good or something. Can we find out? See, so you're developing some trust with it sounds funny, right? Because it's all you. It's all part of you. But you're developing some trust with a part of you that maybe has been like a wall for a long time. And often, there, you know, depending on the therapy, you might have to do something there to help with that. But let's say the part does agree, then you're meeting this wounded part. And, then there's a whole process there to be able to help that part recognize, like, it's probably carrying some kind of burden, right? Like a belief that if I make a mistake or whatever, people will laugh at me, I'll be like, I don't know, I'm worthless or something. And when you find out and you connect with that child and you actually see it as a child, like actually help people like ask questions like, how old does this part seem to you? And people will say like 7, 8, whatever. And it's like, okay. And most of the time people are going to be able to like see it differently now, because in the past, like they might have thought, I'm not even going to go there. But when they see it, that it's actually a child, it's like, oh, I thought this was going to be scary, but it's actually just a kid. There's a part of me that's just like a kid. And all of a sudden it's like, well, what would you might ask, like, what does that kid need? Or what, and the kid might, you might actually say, or whatever. And sometimes it's like super easy and obvious. Like the kid needs a hug. The kid needs to know he's an awesome kid, and you'll be there for him if anything goes wrong or something, or, whatever he needs. And if a person can't quite do that, sometimes, because that's really hard to do for yourself, sometimes I'll say, well, do you have like a kid who's 7 or 8, or do you have a nephew or niece? Have you ever seen a kid? And if they have, so if they like, especially like often they'll say, yeah, I have a son who's 8. And you say, well, what would you say to him if he fell down on stage after, like during a play? What would you say to him after? Usually they know what to say. Like they would know, how to comfort another person, but they have a hard time, doing it for themselves. So you're there to help them as a therapist. You're there to help them do that process. And it's amazing. And sometimes the burden for that kid just is like, can actually make kind of visible and actually can help. Like, let's put that burden down. And from a Catholic perspective, there's so many options depending on the person. Like sometimes it's like, let's bring that burden to the cross. Or sometimes if they're having a hard time, like accessing that self I was talking about, for whatever reason, but you are somehow in this process, you're accessing this wounded part. Sometimes it's like, well, can we pray and invite Christ to be here for this? I don't do this unless it's a Catholic person and they're okay with that. But or sometimes it's Our Lady. And I found that like that can be very powerful. Usually I've done a little bit of checking in with their relationship with God, because if they have a complicated relationship with God, or I don't know, so it can make it messy. But if not, most of the time what they would say, like they would pick an image of God, right? That it might not be God the Father, like it might be Christ, or it might be Our Lady or something, or maybe it could even be an angel or a saint, but that is a resource for them that would know how to love that little kid. And so they could see, what would Christ do? And then they could see that, and then that helps them to then be loving toward themselves. That's a big part of it. Is so okay, then so after that process where there's some care and love and kindness to themselves and a little bit of healing, and you're taking that little kid and you're bringing him out of exile, you're inviting him into the whole system, right? And then you checking with that protector and saying, because the protectors in a sense is watch this healing happen. And now it's like, okay, protector, you still have to protect the kid, but we're not locking him in the closet anymore. We're let him be part of the system. Is that okay? And they're always okay at that point. And now the kid is like present in a good way in your system. And then we're checking a little bit with those firefighters, because the firefighters had the job before of like doing whatever they needed to make pain go away. But now we've just done some work to help heal that. And so the firefighter, now we're checking with them and realizing, well, the firefighter is really a manager who took the role of firefighter, right? And so now we're going to say, well, what next? Because the kid's bound to have some bumps. Our system is bound to feel some pain sometimes. What can this manager that used to be a firefighter now do in the system, that manager, maybe there's better ways of handling pain, better ways of dealing with disappointment, loss, and loneliness, all this kind of thing. So you do some work with that. All right. I'm looking at the time. All right. So I talked for like 30 minutes and I gave a lot. It just all kind of flowed. I hope that made sense. I'm open to questions and thoughts and comments, or if anybody wants, I can even like walk you through a little the process of encountering a part. It's up to you guys. Or you're all asleep. I've lulled you to sleep because it's Saturday afternoon. And you're all muted in case anybody is talking.
That's all really clear, Gerry. I think you did a fine job.
Oh,
Laying it
good.
out.
Awesome. Did anything speak to you? Like, did you notice, or like, because I know it sounds a little, might sound to some people, it might just sort of sound interesting theoretically, and some people might just be like, all these terms and strange. So I'm curious, like, did any part of it like resonate with you or speak to you?
Yeah, I'll jump in. Yeah, a lot did speak to me, and I think I posted too on the forums about my daughter, who's actually been through a little bit of this. But even when I look at my own life and my own experiences with some sexual abuse, I can see that there's definitely something there that it's definitely something I need to think more about. And even, just as you were talking and I was thinking about my week, this week, my dad and I have been kind of going back and forth. He's angry at the world right now. And I'm angry at him because, because he can't seem to forgive people. Trying to think of the best way to explain this. But anyway, I tend to shut down when he becomes angry. And it's almost like this little boy part of me just wants to run away, and I can't talk to him about it. And so I kind of harbor all of these feelings inside. So some of what you're talking about, it reminded me of that experience that I just had with my dad earlier this week.
Yeah. And so that's really interesting because you're bringing up a good point. What happens in relationships a lot of the time is that it's our parts talking to the other person's parts, if that makes sense. And so your dad, and I don't know him or anything, but from the little tiny bit you just mentioned, if he doesn't want to forgive, or he's got a bitterness or anger about something, then that's a part. And that part has probably been hurt, right? And has been in some way offended or hurt or something. And so that part is blended in with the self. So you're encountering him that that part of him dominates, right? And then that's triggering in you some other part also that's maybe been hurt or wounded before, or a part that is, like the wounded part wanting to run away, or the protector wanting to help him run away, something like that. So you're dealing part to part, and it feels very unsatisfying in a relationship. And what would have to happen, right, which is difficult, would be, for example, your dad would have to recognize that part. And what we would say in internal family systems world is say to be in self. So if you're in self, you kind of unblend from those parts. So I like as an example, I'm not actually nervous today. So I have been nervous before in public speaking. I think I've been doing more and more of it, that I don't get, I've been overcoming that pretty better, but I'm capable of a lot of nervousness. So if I was super nervous today, then I would have to recognize there is a part of me, kind of a protective part, that that is freaked out and is worried and scared, that has fears that I'm going to make a mistake, or people aren't going to like me, or whatever. People are going to think I'm not smart, or I don't know what. And so what I would typically do, right, in the past maybe, would be to say, stop that, to myself, like, get over it, come on, like, you've done talks before, this stuff, come on, So which is actually another part, like telling that part it's something's wrong with it, basically, instead of me as the self recognizing and recognize, like kind of accessing the self a little bit, kind of getting a visual internally on this scared part and saying, okay, I get it. You're scared, and yeah, your fears are reasonable to some extent. I hear it. I hear you. I see you. It's going to be okay. Right. And so the core self is comforting a part of me that's scared. And usually that is helpful. It might not work 100% all the time, especially in a moment, but it often will really help that my whole system will kind of calm down. Okay. Right. Which is the opposite of what would happen if I just say, shut up, come on, you got to do this. Right. Then that part's going to get more anxious. And then I'm going to stand up there and shake. Right. So in your dad's example, though, and I'm going to speculate to some extent, but if you don't want to forgive and you're angry, it's because you've been hurt. And if on some level you or somebody else is saying, why don't you forgive people? Or, you're not being a good Christian, or you've got to get over it, or something, then that part of him is probably getting more entrenched, not less. And so a different approach, which would be ideal if he could do for himself, to shock me if he could, probably, but if he could, maybe somebody helps him with it, would be, I get it. You have every right to feel angry, and I understand it's hard to forgive. And then that part actually starts to calm down a little bit because it's understood. So it's basically empathy, right? We empathize with that part. And then that opens up the possibility of them hearing the next part, which might be, yeah, but if you hold on to that resentment, you're going to lose relationship. Is that what you want? And then maybe after feeling empathized with, there might be some movement or not. But you're not going to be able to do that with him if you have parts that are running scared because they're like, oh my gosh, he's being that way again. And, and when that happened before, I was in trouble, or it was dangerous, or whatever. So like I'm saying, it's your parts are interacting. And there's no guarantee that if you were totally in self and you were able to try to speak to your dad in self, there's no guarantee that he's going to respond well, because you're still dealing with one of his parts. The best is if he can learn to do that. So it makes it hard. In relationships like marriages and stuff like that, it's so awesome when with our spouse, we can be in self and they're in self and we're connecting. That is the deeper level connection. Right. And and the different psychological theory would say that's secure attachment. I can empathize. The other person can be vulnerable. I can be vulnerable, and they're going to empathize and care for that. And that when it's that kind of safety and security in the relationship and vulnerability and empathy, then that has to be self to self. Right. That means we're and all that. And when something happens, so you say the wrong thing and insult them, the other person, they know you are, how much you love them, and they feel that connection. So they're not going to like punch you in the face. Instead, they're going to be like, what happened there? Because I know we're good. I know we have this connection, but what you just said actually hurt my feelings. And then the other person's response in self is going to be, oh my gosh, I'm so sorry. And this is what I meant. And why did you receive it that way? And then it's like, it's a different conversation than you see a lot of couples have when one person, says the wrong thing and they get into a fight, because they're all their parts get activated now. Right. And if we're married and you have a wife, then you might know that your wife has parts, and she's going to one of those parts, if it blends in with who she is, and it's angry, and that part has been feeling resentment over a bunch of things for a long time, then you're going to get a really angry part. But if you say to your wife, honey, you should just be in self more, she'll probably hit you. So you can't do that. I'm not speaking from experience. All right, Rob, sorry, I said a lot in response. Does that?
Yeah, no, that was great. Yeah, I can see definitely where this could be very helpful in a lot of situations. So yeah, there's a lot to think about there. Thanks for that.
Yeah. And I can say how powerful this works too, because I know you shared, I don't know what Garrett knows, but and Mac does know, but I don't know about Garrett, but I have an abuse history as well. And I have done both parts work and EMDR for healing for myself. And so I can really attest to that like I'm really generally now really in touch with, I have a 5-year-old part, a middle school part, and a high school part of me that each I check in with. And it's very healing and very powerful to for my internal system for those parts, because I didn't recognize, there's so much I learned about my wounds and the way that my child part takes it, because a child, or a middle schooler for that matter, is going to experience abuse a certain way from the point of view of a child. And if that's a part that's kind of trapped in your system in some way, then it's operating from that point of view. And then but as an adult, the self or other manager parts of your system, they're adult like, are going to not understand that. And so doing this work really helps to kind of like learn to have better empathy and understanding for self. And I do a lot of work, like my dissertation was on male abuse survivors, and I do a lot of work with male abuse survivors. And so, and to a person that I've worked with, they all have this huge self-hatred. And it's a little bit hard sometimes as a therapist, because you're just like, you get to a point and they're so like, I think of a few different clients who are like, they're so mean to their inner child. They would, and I know them, and I'm like, you would never be that mean to an actual child, but you're that mean to your inner child. And it's like this self-hatred, because they're approaching that child from an adult perspective, not from how a child sees the world. And once they see it from the child's perspective, once they really know that part, and they actually can, it's not just a question of knowing it, it's actually like feeling it, being with it, something happens. And it's like, oh, you were just a kid. And that might be obvious to everybody else. Like, of course you were just a kid. But to the person that experienced the abuse, it's not obvious until you do this work. At least that's been my experience, that, oh, you were just a kid. No wonder. Right. And that can be a powerful, powerful moment. Garrett, did you have any questions or thoughts on all this?
No, not really. Like I said before, like I've been going through just some of my parts. I know I've got a lot of firefighters, like the running away. I really want to do that. Binging YouTube, probably even just trying to take a nap as well.
Oh yeah.
So yeah, there's a lot there for sure.
Mm-hmm. Good. Okay. Well, I'm glad it's helpful. And some of it's theory, so it's another thing to kind of put it into practice.
Yeah.
Mm-hmm. And so maybe what I could do, maybe like rather than single 1%, because we're such a small group, but maybe I can just do a little activity that you don't have to share anything after if you don't want to. Anybody doesn't have to, but just to sort of maybe get a little experience of what it feels like a little bit to do this. So I'll just use it a little bit. If you're comfortable, right, and you're in a sort of a comfortable place, and you can just take a few deep breaths and just kind of relax as best as you can where you are. I'm just going to ask a few questions and just sort of see what comes up for you. And once we're done this, don't feel obligated to share details of what happened. I'll ask like how it felt for you, but it'd be just up to you, whatever you want to share. But so I'll just sort of do some of the language here. So leaning back in your chair, just notice relying on and depending on the chair to support you, or the couch, or wherever. Turn your attention in your breath. Allow your breathing, allow your body to breathe for you. Perhaps breathe in and invite the Holy Spirit into your heart. Notice as we turn inward, we look inside, just notice if there's any, we call them parts, but pretty aspect of yourself that is a little agitated today, or is a little more present than otherwise. Notice if it's present in some way in your body. Like sometimes people will notice a little anxiety in their chest, or a feeling in their gut, or tension in their shoulders. If you notice any of those kinds of things, see if you can connect that with a part of you that might be agitated or preoccupied with something. Just check in if you're able to visualize, that sensation, that feeling, that preoccupation. You're able, or it might be an emotion. If you're able to visualize that as a part of you, maybe you could visualize, a space inside of you, like sometimes people choose like a little conference room or a little living room space, and sort of notice this part of you as, just sort of being there, being present. And just sort of notice whether this part feels comfortable or is a little activated. Just see if you can just notice it. I'm not going to do anything to it or approach it. We're just going to start off by just sort of noticing it. And if it has a worry, see if it can in some way communicate to you what it's worried about, or what it's preoccupied with, or what might be bothering it. And so just notice how you experience that part. And as you hear it share something, if it does share anything about what's bothering it, as you're noticing that, sort of notice how you feel toward this part. And if that part is what you notice about it is critical, or has some kind of agenda, or how you feel toward it is some way negative, then that tells us that that's another part, that there's another part in there that has an opinion, or has a criticism or a negative feeling about the preoccupied part. I'm assuming it is preoccupied. I'm not asking any one person. It might be something else. But if that's the case, then just notice, hey, there's two parts. Sometimes we will have multiple parts and notice that have a little conflict with each other. And what we're going to do now is we're just going to maybe do the same with this other part and just say, hey, notice it, hear what it's worried about, hear what it's preoccupied with, and just noticing that. And if for either one or both of these parts, or if we only have one here, let's take a moment to just, as best as we can, understand where the part's coming from. And if it seems right, to be able to say to this part, I get you, I hear you, I get it. Might not even that you're conscious, you may not agree 100%, but you get where it's coming from, at least. If you don't get it, it'd be good to ask some more questions to try to understand better. And if you do feel something toward this part, like compassion, if you do feel like just curious and understanding, and and a desire to connect with the part, then that tells us that we're accessing a little bit of the self, that the self is, our core self is showing up, or at least it's always there, of course, but it's more present, and it's more the, I don't want to say the real you, but the core of you, a deeper part of you, deeper, not a part, core of you that is showing up. And if that happens, that's okay, that's great. And notice, let your core self have compassion, and understanding and empathy toward these parts, even if maybe if there's two competing parts, even on both of them, that you on some level, okay, I get you and I get you. And if it's possible, see if those parts feel that compassion. And if they do, really notice what that's like for them. They might be a bit surprised. And so if we do have parts that are in conflict, and if they felt a little bit of understanding, now maybe there's room that self, that core self, can help negotiate, if you will, can help come up with what a good choice is, or what good way to handle it. It might mean that some parts are not going to get what they want, or not as much of what they want as they want, but they will know that the core self is the one carefully, conscientiously making a decision to help. And so we're going to wrap up this activity, but before we do, because this was just a little taste, and because I was doing generically, I don't really know what you were experiencing and how well it resonated with where I went. But if any parts showed up, even just one part, now's the time to thank that part. Thank them for being present, for being willing to do this little exercise and give it a try. And that wherever they were before, they're allowed, go back there and you thank them. And we just I don't like to leave them hanging. I like to be gentle with the self and the whole system. And we're just going to come back to the here and now. And that's all I wanted to try with that. Let me know what that was like for you. You can share details if you want, but just, I'm really curious whether you're able to connect a bit with that. I know it's weird to do it in a group, but Or did I really put everybody into a deep meditative state?
So I guess I'll jump in. Yeah, I think I came to seeing two different parts, kind of going back to the example with my dad. That's something that's been on my mind. In fact, I went to confession about it this morning, so it's been on my mind today. So yeah, I'll just say that I think there's two parts there.
Awesome. That's good. You were able to connect the two parts in whatever the process was. That's great. That's what I was hoping for, is just to, to have a taste of what this is like. That's great. Well, if there isn't anything else to share, we're going to close up because it's just after 5. So I want to thank you guys for coming and spending a bit of time with me this Saturday afternoon and to learn about parts. And I hope you enjoyed it. And everybody that is listening after the fact, love to hear in the comment section your thoughts and your experience, and we'll go from there. And we'll also be looking for topics for the next web meeting. So we're going to do something different each month. So and I always have something I'll do. Like, I've always come up with something, but I actually love to get suggestions. So I look forward to those. All right, guys, thank you so much. Hope you guys have a great rest of your weekend.
Thank you.
Thanks,
You
Gerry.
too.
Thanks,
See
Gerry.
you later.
All right, bye-bye.